patients at my clinic literally save hundreds, if not thousands of dollars on annual labs, and it does not matter if they have insurance. My name is Jay Vintage. I'm a board certified family medicine physician. I own and operate a little direct primary care clinic called the Little DPC. And I want to play a game with you. It's going to be a guessing game. I'm going to list out my pretty standard establishing care labs. I want you to tell me what you think it costs. And then I'll let you know the answer. So here we go. You ready? That is a CBC, a CMP, a TSH with a reflex T4, a hemoglobin A1C, a lipid panel, apolipoprotein B, lipoprotein little a, TSH with reflex T4, HIV, hepatitis C, sometimes an RPR, depending on the population. So that's generally what we get. And we're not even including some of the add-ons like vitamin D, vitamin B, etc. Okay? So I want you to think of a number in your head, write it down in the comments, don't send it yet, and I'm going to tell you exactly what that costs. But before we do that, I'm going to tell you exactly how we're able to do it. So in direct primary care, we don't mess with insurance at all. We think that insurance often stands in the way of people getting the quality care that they deserve. When doctors take insurance, they got to see like 30 people a day and they just don't have time for you. As a matter of fact, a recent journal article in the Journal of General Internal Medicine, 2023, they said in order for the average doctor to be able to provide the kind of care that is too standard, it would take the average doctor 26 hours a day based on average patient populations. 26-hour days is not something that doctors have. So what do? And who does it affect? Because at the end of the day, it's generally the patient. And the doctors have way more work than they're used to. And so the system forces people sometimes to cut corners, and that's what forces doctors to get into direct primary care. And if it sounds too good to be true, hold on to your hats, because the price of what I just said is costing my patients $64, right? We also have x-rays for less than $100, usually between $60 and $90, depending on what the image is. CTs are $200, MRIs are $300, okay? And then the medications, instead of 50 cents a pill, $1 a pill, $1.50 a pill, especially with copays and things like that, regardless of insurance, we're talking 1, 2, 3, 4 pennies a pill. And so we're able to save people money that way. How are we able to do it? We break even on most medications, on labs, and on imaging. It's a break-even enterprise, but patients pay me a nominal monthly fee. Usually comes out to be about $100 for 24/7 access. Their first visits are usually about an hour and a half. They get same day, next day appointments when there's urgent matters, and they can text me around the clock, and they can expect a response very quickly, much more quickly than the other guys can do. So that's direct primary care. Look it up on dpcfrontier.com, Mapper.